Come on in. Just wait a little bit here for a few more people to arrive. We'll get the PowerPoint synced up, our very last day. Let me just this and this. And this. All right, we are close. Just get this opened here and then we can get started. Why is this so darn big? Just oh, there we go. All right. Okay, we're going to get started. I realize there's only 2 of you, but 2 of you is more than no of you, and we'll get started and do this last little bit, and hopefully some people will join us as we move along, because I want to make sure that we get it finished today. So there we are. We were just going to finish talking about in vitro fertilization, and I had a little PowerPoint I was going to share with you with that first, and then we'll talk about parturition and lactation, and then those are our last 2 main topics. So just get to where we ended up here. Yes. It's a very long presentation. Ultrasound and endocentesis. And there we go. So we will just watch a quick video. I have 2 here for in vitro fertilization, but we're not going to watch both. We're just going to watch the first one. And that will be enough, because remember, in vitro fertilization is one that's fair game. So we'll just share this with you guys here. There we go. Oh, sorry guys, sound.
For about 10 days to stimulate her ovaries to produce a large number of mature eggs. In a normal month, a single egg might mature, but with these supplemental hormones, a woman might produce as many as 20 mature eggs. Doctors can collect the mature eggs through a small incision in the woman's abdomen or by a needle that is inserted through the top of the vagina. The eggs are drawn out of the ovaries and placed in a tube containing culture medium. The male provides a semen sample. Approximately 60,000 of his sperm are added to the tube. On average, the sperm succeed in fertilizing 70 to 80% of the eggs.
So we're just going to pause there for 1 second. So when we have a couple that's dealing with infertility, so there could be all sorts of reasons for it. It could be that the woman can't produce eggs. It could be that man can't produce sperm. It could be that the woman implantation just doesn't occur in her uterus. So there could be like a million different reasons why. And just some thoughts on that, because my husband and I went through this. At least 1/3 of the cases of infertility, they don't really have a reason why. So when a couple's undergoing fertility, before the doctor even looks at them, they have to be trying to get pregnant for a year. Okay, so after they've been trying to get pregnant for a year, then you can start looking at fertility treatments. The first person they look at is the male, because it's easiest to test and to do a semen sample. So that's the easiest thing to do. If the sperm is seeming that it's viable, then they start investigating the woman. Okay. So in this sample here, so when we're talking about in vitro fertilization, all that really means is fertilizing in glass. In vitro means in glass. So fertilizing typically in a petri dish, right? They have a test tube in this example, but typically in a petri dish. But it could be that woman's eggs work fine, woman's uterus works fine, man doesn't produce sperm, so now we have donor sperm, okay? Or it could be that woman doesn't produce eggs, but her uterus works, so we have donor eggs. Or it could be woman's uterus doesn't work, but man's sperm works, and woman's eggs work, so in vitro fertilization, but a surrogate is used. Or it could be woman doesn't want to have a relationship with a man but wants a child, so in vitro with a sperm donor so she can carry her child. So multitude of reasons of why this happens.
The glass tube or dish gives this procedure its name. Translated from Latin, in vitro means in glass. If the sperm have trouble swimming to the eggs, another development in the procedure can remove this barrier. Working with the aid of a microscope, a technician can give the sperm some help by injecting a single sperm into the cytoplasm of each egg. This procedure is called intracytoplasmic sperm injection.
This would add more money
After
to the
2
cost of
days,
the
the fertilized eggs have divided to form multicellular embryos. 2 to 3 of the healthy-looking embryos are then placed into the uterus of the female. In 50% of these attempts, in vitro fertilization leads to pregnancy.
So in this situation, we have to remember that if the woman wasn't ovulating before this, then she's not going to have a corpus luteum producing estrogen and progesterone. So she's going to have an external source of estrogen and progesterone. So in a pill form or a patch, in order for her endometrial lining to be prepared for these blastocysts that are being put inside the uterus. Okay. Now they'll usually put in 3 or 4 embryos, and usually, like they said in the video, 50% of them take. I have a cousin, his wife had fraternal triplets, and that was through this process. So 3 of them took.
A single embryo may progress to a full-term pregnancy, but there is also a chance that a few will survive, resulting in twins or triplets.
That was it. Okay. All right. So let's go back to the PowerPoint. There we go. So any questions about in vitro fertilization? All right. So again, we want to make sure we're understanding it's not the fertilized egg that goes into the uterus, it's the blastocyst, right? There's no way to get that single teeny tiny egg inside the uterus, and it wouldn't implant anyway because it's not prepared. It has to have that chorion layer where it's going to have the chorionic villi in bed, right? So it's very important it's at the right stage, and it's very important that the woman is at the right stage in her cycle, whether that's produced synthetically through hormones or whether she's just finished ovulating. Okay. All right, childbirth. Oh. So Eric, you're talking about if none of them actually start implanting. Is that what you mean? So Eric's asking if it doesn't work out. Yeah, then they can keep trying. So like I said before, this friends of ours, they have a couple that they know that went through this process, and it was the 3rd month before they had one take. So each month is about $5,000. So it's just whether you can support that financially, because I don't think a lot of employment health plans actually cover that procedure. So it is quite an investment of money. And then I know of a woman I met, she went through this process and she miscarried a few of her in vitro fertilization pregnancies. So quite a loss in those situations. So yeah, they would continue the process, because usually that initial fertilization, you get quite a few embryos out of that. So you can continue that process for several months. Yeah. Okay. Parturition. So you have to know that word. So parturition means childbirth, right? That's the process of childbirth. That's what we're talking about. So there's a hormone called relaxin. So relaxin relaxes, all right? So this is one hormone that makes this birth process a little bit easier. So it's a hormone that's produced by the placenta right before labor. And what it does is causes the pelvic ligaments to loosen. So in our pelvis, we have several regions of bones, and they're connected by this sort of cartilage kind of material. And that cartilage loosens a little bit to allow for more flexibility, so it's easier for the baby to move through the birth canal. Okay, relaxes the cervix. So remember, the cervix is a muscle between the vagina and the uterus, but the cervix is really tight together, and it allows that to relax because it actually has to dilate 10 centimeters for the baby for that push action to start happening with the baby. All right, so the hormones that are involved in this process, besides relaxin, we have oxytocin. So we talked about oxytocin way back when we did the endocrine system. So it's produced by the posterior pituitary, and it's activated by stretch receptors. So the head is in the downward position at month 9, and it starts moving through the birth canal. As it moves through the birth canal, it stretches those receptors. So those would be an example of mechanoreceptors. So they stretch, they depolarize, and in that process of depolarizing, they send a message up to the hypothalamus to produce oxytocin, send it to the posterior pituitary to release it, and then that causes those uterine contractions to occur. Okay? And the thing that happens is as the baby's head gets further in the birth canal, that causes this reaction to happen more stretch receptors, more movement into the, or more messages going sent to the posterior pituitary to release more oxytocin. So the contractions get stronger and stronger and stronger as we go through this process. Okay. So women will start labor where they might be an hour apart. And if it's true labor, because there's kind of this false labor called Braxton-Hicks contractions, but if it's true labor, those contractions get closer and closer together until they're about 2 minutes apart, and they're very, very strong contractions, so quite painful. So the more the baby stretches the uterus, the stronger these contractions, so then the more the baby's moving through the birth canal. So this whole point of contractions, once they get to be 2 minutes apart, that's usually the strongest that they're going to get. That 2 minute apart bit, women can go through for a few hours. I think I did for probably about 4 hours with my first child. With my daughter, quite significantly less than that. Okay. So the more the baby stretches the uterus, so the more this reaction happens. And then prostaglandins are this whole other group of hormones that actually have a very localized impact. And they're produced in the uterus wall, and they amplify all these effects from the oxytocin. So you get this double whammy of contractions. Okay. All right, so what we see happening here, so childbirth itself has 3 phases. Yep, baby can still be delivered. So if mom's unconscious or if mom's in a coma, baby can still be delivered. Absolutely. Yeah. So these contractions will push the baby. Yeah. All right. So we see baby's head. So we start with baby's head starting to move in the birth canal, and the end point of this first stage, the dilation of the cervix, is the cervix getting to be 10 centimeters. So usually it's like this teeny tiny little space, like a millimeter. It grows to 10 centimeters. Okay. So the baby's head triggers progressively stronger contractions. Baby's moving through the uterus. The cervix slowly thins and dilates with each contraction. So it's thinning out and it's dilating. So the nurse who's looking at the woman, she's seeing, let's look here. So she's seeing what's referred to as crowning, where you start seeing the top of the baby's head. And then we have about that 10 centimeters diameter there. Okay. Now, somewhere along these lines, it could be before she got to the hospital. So usually on television shows, you hear my water broke, and then, you know, slowly they make their way to the hospital. It doesn't have to be that way. The water can break in the middle of this process of the contractions as well. Okay, so, and it just depends on the pregnancy. What else was I going to say about this? I think that was it. So yeah, so then we get to this point where all of a sudden we've gone through this stage of the cervix reaching its dilated point. Okay. All right. So then we get to the second stage. So the second stage starts when the cervix is dilated 10 centimeters. So like I said, that process can take a couple hours, half an hour. It depends on the woman and the pregnancy. So the cervix dilates. So we still have these strong contractions, but now we have this really crazy urge to push, right? Now that push urge, if you're in a coma, you're not going to have, but you'll still have the contractions that will push the baby out. But if you're conscious, you have this urge to push, and you push this baby out, and it's overwhelming. It's like, it's really not much you can do to stop that urge. And then the baby is born. So this part here, the baby being delivered, this can be short-lived or long-lived. So it can be a short-lived process. For my son, my oldest boy, it probably took about half an hour. For my daughter, it took about, I think, a minute, maybe 3 minutes. It did not take very long at all. And then my youngest boy was about the same. Okay. So again, it just depends on the person, how many pregnancies they've had. There's all sorts of things. Okay. So at this point, we go from the cervix being dilated to the baby being born. So once the baby is born, the blood is moving from the placenta to the capillaries of the lungs. So baby now has to breathe on their own. So they're no longer dependent on mom. And somewhere in this process, as the baby's coming out, the umbilical cord is cut. Okay, so that connection to the placenta is done. And usually dad gets to do that, as long as there's no nothing happening to the baby. As long as the baby's okay, then usually dad gets to do that. Okay, so now we have stage 3. So stage 3, the placenta is expelled. So in stage 3, the placenta and extraembryonic membranes are delivered. So really, the woman has gone through labor, contraction. Now you're pushing through the contractions. Now baby's born, and now a few minutes later, it's like you're going back through labor again. Okay. So what that means is the contractions are starting again to remove the placenta and all of these other materials. Okay. So everything's getting released and then is delivered by mom, and baby is born. Okay. So I have just a little animation. This is about a minute long here. Watch. So let's go to share. There we go. Now we'll restart because that's how this rolls. Okay, so what we're seeing right here is the pushing part, right? So this is the first part. So eventually the cervix dilates, and once it's reached its 10 centimeters, then we're into the second stage, right? So there's the crowning. So now we're into the second stage. It does not happen as fast. That cake structure is like the amniotic sac. Here comes baby. And then a few minutes later, that's when the placenta will come. Okay. Oops. Just stop this. There we go. So we'll just go back to the PowerPoint here. All right. And I think, oh, go back. All right. So then baby is born at this time. Okay. Now, I have another link here. I actually linked a MP4 of the full video. It's called Body Atlas, the Womb. What I like about this video, but we're not going to watch it because it's too long for us to do online, but what I really like about the video is it really goes through all of these stages of fetal development. And then about the last couple of minutes, it goes through the whole point of parturition. I don't think the doctors really have to do a lot of pulling of the baby, not anymore. Baby usually just comes out. They mostly just catch. I think the biggest thing that you want the doctor there for, or your midwife or what have you, is just to make sure the umbilical cord isn't around their neck. Because obviously if you're pulling on that and the baby's being born, that can cause problems. So I really don't think that's a huge thing. Sometimes there's some interventions where they're using different things to try to get the baby out, but I think they've really gone away from that and just waiting and being patient for this process. So really, unless the baby's in distress, you can keep this process going. The other thing is breech baby. So I mentioned them before. So a breech baby means when you're not coming head first. So like I said, my brother and I were both breech babies. So we came out bum first. So when I was pregnant with my first child, I'd asked my doctor about breech because I didn't know maybe you inherit a certain shape of your uterus that leads to your baby's being breech. And he said if we found out that it was breech, he would do a C-section. I'm like, well, I don't want a C-section. But he said the reason why, the head is huge on a baby. The head makes up 1/3 of their body size. So when a baby is born head first, which is the norm, this big giant head comes out first and then the rest of the body just sort of slides out. But if a baby is born breech, the whole body comes out because it's small, and then this giant head, what if it got stuck? And he said, if the head gets stuck, then you go for an emergency C-section instead of a planned C-section. And then, of course, anytime you do a surgery through emergency, that adds more risk to it. So his explanation made sense, although all my children ended up being born head first anyway, which was fine. So yeah, just things to think about. Other things, oh yeah, this video here. So this one is narrated, it's sort of an American narration. I linked the actual video. So this is one I just found on YouTube, but I linked the actual video in my notes for this section. So you might want to just watch that one instead, because then it's actually the real narrator that's narrating it. But like I said, I really like the video. I think it's a really good kind of summary of what we've been talking about. All right, any other questions about parturition? Okay, so our last section to talk about is lactation. So let's just go on to the next slide here. So lactation, process of making milk. So what I like about this image is it just highlights some of those parts of the breast that we need to be thinking about, right? So here we have the mammary glands. Okay, so all of those are going to be the little milk producing areas, right? These are the ducts. Those are the milk ducts that are going to bring the milk from the glands to the nipple. The areola, so the areola is the brown segment around the nipple, okay? And then fatty tissue, because the breasts obviously have lots of fatty tissue in them as well, okay? So mammary glands, so these are the site of milk production. And then milk will move from the glands through the milk ducts and then to the nipple so the baby can be fed. All right, process. So we've talked about these hormones already, so these aren't new to you, but we still have to know them for this unit. So prolactin is produced in the anterior pituitary. So what happens is high levels of progesterone. So remember, woman is pregnant. She's got these super high levels of progesterone while she's pregnant. That's helping to maintain the endometrium, make sure that it's got lots of nutrients, lots of blood vessels, right? Well, what that's doing is that it's actually inhibiting prolactin. So prolactin is actually going up as the woman's getting pregnant, but progesterone is inhibiting the action of prolactin. So once progesterone drops for parturition to happen, then prolactin activity starts and the real breast milk starts being made. Now, some milk starts being made prior to giving birth, and this source of milk is referred to as colostrum. And colostrum, because real milk doesn't actually start coming until about 3 or 4 days after the child has been born. So we have this colostrum, which is being produced before child is born up to about 3 or 4 days afterwards. Now, colostrum is super, super high in maternal antibodies. So really nice to be giving that to baby because that just helps boost their immune system, okay? The problem with colostrum is it's really low in fat. It's high in sugar and it's high in protein, but it's low in fat. So the baby doesn't get that sense of fullness. So it isn't uncommon for baby in those first few days to want to nurse every 1 to 2 hours, which means mom's waking up every 1 to 2 hours to feed baby. So it can be very exhausting for those first few days until that full milk comes in. And then at that point, there's more fat, so baby might want to sleep for maybe 2, 3, or 4 hours at a time. Okay. So stimulates the mammary glands to produce milk. So prolactin, production of milk. And then oxytocin is released by the posterior pituitary. So that suckling action around the areola, those nerve endings send a message, right? So they get their own deformity, right? They're also mechanoreceptors. They send a message to the hypothalamus to tell the posterior pituitary to release oxytocin. So oxytocin gets released, and then that's going to cause those milk ducts to contract so the milk can be released from the breast. Okay, so milk ducts contract, milk is released from the breast. So these two hormones work as a team. So if we look at this illustration here, okay, so we see the suckling action. So the suckling action is actually sending this message. So it's a nerve message, and that's going up to the hypothalamus, and that's going to cause both release of oxytocin and prolactin. Okay, so oxytocin and prolactin are released, and then baby gets milk. Okay, so we're just going to watch just a short little video on lactation. We can make this one.
A complex interaction of pregnancy hormones signals the development of breast tissue in preparation for breastfeeding the expected infant.
Nice if it actually just worked the first time I did this.
A complex interaction of pregnancy hormones signals the development of breast tissue in preparation for breastfeeding the expected infant. The amount of the hormone prolactin, essential to the initiation of lactation, increases steadily throughout pregnancy. However, high levels of both estrogen and progesterone during pregnancy inhibit the action of prolactin on mammary tissue, so no milk production occurs. After birth, levels of estrogen and progesterone drop, and inhibition of prolactin action on the mammary glands ends. After parturition, the primary stimulus for the production of prolactin is the sucking action of the baby. Stretch receptors in the breast send nerve impulses to the hypothalamus. The impulses inhibit a prolactin-inhibiting hormone, PIH, and stimulate a prolactin-releasing hormone,
You don't have to know about
PRH.
PIH and PRH.
Increased PRH triggers the release of prolactin from the anterior pituitary. Prolactin circulates to the alveoli of the mammary gland and promotes lactation. Once milk is formed, it is ejected or let down by the action of the hypothalamic hormone, oxytocin.
Produced by
The primary
hypothalamus.
stimulus for oxytocin production is the sucking action of the baby. Stretch receptors in the breast send nerve impulses to the hypothalamus. The impulses stimulate the production of oxytocin. Oxytocin circulates to the myoepithelial cells, surrounding the alveoli of the mammary gland, which contract and force the milk out of the alveoli into the ducts where it can be suckled.
Okay, so just a little summary of what we just talked about. So we'll go back to the PowerPoint here. There we go. All right. Oh, perfect. Go on. Okay. All right, so just a couple things with benefits of breastfeeding. Now, just to give you a little bit of background on this, breastfeeding is available to all mammals. So breastfeeding is something that we have, that ability to nourish our young for a period of time, okay? There was a line of thought that probably started around the 1920s, 1930s, and went for quite a long period of time, that was that formula is better than nature as far as breast milk goes. And I don't know why we had that, but it's tended to be here in North America and didn't tend to be in Europe. So my grandmother-in-law did not breastfeed my mother-in-law. So, and my mother-in-law was born in 1951. So it already started then. And then my mother-in-law didn't breastfeed her sons, my husband and my brother-in-law. It just wasn't something that really was done. Now, my mom was a bit of a rebel. So for my brother and I, she did nurse us for the first few months after we were born. But my dad, who's from Denmark, it was silly not to breastfeed. So it was a social paradigm that we had developed here not to breastfeed. Now we've kind of gone the other way, where some people call women not a very good mother if they don't breastfeed, and that's not responsible either. There's all sorts of reasons why a woman might choose not to breastfeed, and those reasons have to be respected. But I'm going to talk to you about some of the reasons why it is a benefit. So one of the main benefits is it transfers antibodies to the baby, right? So the baby, when it's just born, has this bit of a boost to their immune system. Breast milk is always sterile. So when we have bottles, we have to sterilize the bottle, we have to sterilize the formula, all of that stuff. Breast milk is sterile. Breast milk doesn't need to be packed. So you take breast milk with you wherever you go. Breast milk is free. Formula is quite costly. Breast milk helps you to return to your pre-pregnancy shape faster. So after you go through childbirth, you still look like you're about 5 months pregnant. Because remember, your uterus, which is usually the size of a pear, held this 10-pound baby placenta and amniotic fluid. Well, it's not immediately going to bounce back to the size of a pear. It's going to take time for it to get back to that shape. As a woman nurses, that oxytocin is also causing these uterine contractions, which is making the uterus go back to its pre-pregnancy shape. So that can happen at a faster rate. One thing I forgot to write in here, remember to write that, is that women who nurse, remember breast milk, lots of fat, lots of sugar. So the baby is actually suckling calories out of you so you can get back to your pre-pregnancy weight faster, okay? Also helps to enhance the mom-baby bond, right? Not that bottle feeding doesn't do that. Bottle feeding does that as well. There is something to be said about having a baby take milk out of your body. And then lactational amenorrhea. So that's kind of this whole plus where a woman who's breastfeeding for those first 6 months doesn't have her period and can't get pregnant. Okay, so amenorrhea means not having your period. So this is one cause, lactational is caused by breastfeeding, which is the last thing we're going to talk about here. Okay, so lactational amenorrhea, absence of menstruation while breastfeeding. So the reason for this, so it's a temporary method of birth control. So it's kind of like our bodies keeping us from getting pregnant with our children too close together. Okay, it's not 100% birth control. If you truly want not to have another child, you have to use other methods. But what the idea is that high levels of prolactin actually inhibit GnRH. And without GnRH, FSH and LH can't go up. And if LH doesn't go up, we don't ovulate. So, so the uterine lining isn't, or sorry, the endometrial lining isn't thickening. And we're not ovulating. So it's good for a bit. It loses its effectiveness after the baby is older than 6 months. And the breast milk is no longer the only form of nutrient. So usually it's suggested that women breastfeed only. So that's the sole source of nutrients for the baby until 6 months. And then after 6 months, you start introducing little baby cereals and maybe some fruit and vegetables mashed up or what have you as a different source of nutrients. So once we've started that, then that can keep it so our prolactin level isn't high enough to stop LH from being produced. Okay, so that's one of the benefits of breastfeeding as well. The World Health Organization recommends nursing up to 2 years. Now, for me, that was too long for myself personally, but I think because the World Health Organization is about the world, Part of the issues is the sterility of the water or cleanliness of the water. If you were going to use some kind of water for your child to drink and you didn't have access to clean water or to mix formula without clean water, that's going to be a huge detriment on the health of that child. Better to breastfeed, right? So that's probably one of the reasons. And another reason is it is a method of birth control, because in some third world countries, without access to that, you end up with family sizes that you can't support. So that's another thing. All right, any questions for me? Well, Eric and Noah, I appreciate that you guys were here today. Thank you very much for coming. I'm surprised I didn't see more people, but it is what it is. This is our very last class. You guys have been awesome. I am very, very sad that I didn't actually get to teach you in a classroom, because I could have got to know you better, and this would have been much more enjoyable, I'm sure, for everybody. But it is what it is. I want you both to stay safe, and please watch all the protocols. I don't need anyone getting sick. And take care. This is our last official lecture, so I will just be doing, I'll just be online on Zoom from 10 to 12 Monday and Tuesday. But again, email me if you want to meet with me on Zoom. Just send me an email and we can meet that way too. So that's it.
Thank you.
Oh, you're absolutely welcome. I appreciate both of you guys. You guys are both wonderful. So have yourselves a great weekend and good luck on everything.
You as well.
Thank you.
Bye-bye.